Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, April 8th, and this is my daily briefing. Right now in Missoula County, we have had 25 cases of COVID-19, and there have been 332 cases in the state of Montana. There have been 6 deaths in the state, with 1 in our county, and we've had 14 recoveries to date in Missoula County. So yesterday, the governor extended the stay-at-home directive, school closures, mandatory quarantine for travelers, and the restrictions on bars and restaurants until April 24th. This extension is to support the social distancing in our communities to slow the spread of COVID-19. And we really appreciate everyone's help in following these measures. We know it's really hard, but working together on this, we can minimize the number of cases and hospitalizations that we see in Missoula County. Missoula is amazing and how we look out for each other, so please try to keep up the good work. On that note, we have had a lot of concerns about people out on the trails, specifically going up the trail to the L or out in some of our public spaces. And so I just want to reiterate that it is really important that if you're going to be outside recreating, that you maintain that 6 feet of social distancing between yourself and other people. It's best if you can just go in groups of 1 or 2, only have your family members with you, or other household members, just not going in large groups. And if you're out on the trails, try to stay at least 6 feet away from other people. So I'd like to talk about masks. We've gotten a lot of questions about them, so I just want to make really sure that people are clear about the CDC recommendations on masks. We're seeing a lot of people that believe that covering their faces with cloth will prevent them from getting COVID-19, and that's just not true, and it's not what the CDC recommendation is for. The cloth masks won't prevent you from getting the disease, but they are meant to prevent you from spreading it if you're sick and you haven't developed symptoms yet, or if your symptoms are so mild that you don't recognize that you have COVID-19. They're not meant to be in place of social distancing, and the stay-at-home order still applies. We also understand that there isn't a good place to buy cloth masks specifically for this. However, the recommendation is really just a cloth face covering. So you just need something that will cover your nose and your mouth. This can be a buff or a bandana or a scarf or any other kind of face covering that you can fashion out of cloth that you have at home. The face covering doesn't have to be something specifically made for this event or something that you buy at the store. Anything that you have at home will work that you can just have to cover your nose and your mouth. We've had some questions about why our testing center is by appointment only and why people can't just go out to the fairgrounds. So we have several reasons that we went this way. First, we want to make sure that we want to see people as efficiently as possible. We didn't want people waiting in lines in their cars, not feeling well, or creating traffic problems. So by using appointments, we could better stagger the flow of people and traffic, increasing the safety and efficiency of our testing center. Our trial run this last weekend had people in and out in less than 10 minutes, and we wouldn't be able to do that if we weren't using appointments. The other reason that we are doing it that way is that we still have limited supplies. You've heard repeatedly from me and from others that resources are an issue and we need to follow the CDC guidance on who gets tested at this time. We would love to be able to test everyone with symptoms, but that's just not our current reality. And so by screening people over the phone, we can save people that we can't test from sitting in their car, waiting in a long line only to get turned away. Third, why bring everyone out of their houses when we're trying to get everyone to stay home? Yes, the governor's directive does say that you can seek medical care, but providers are trying to use telehealth tools that can support that stay-at-home order and the social distancing efforts. And so that's what we're trying to do as well. Another reason is that we can't adequately staff something if we don't know the numbers of people that are going to come in. So by using appointments, we can make sure that we have the right amount of staffing there to provide the service and reduce the waste. And this means a much better use of tax dollars and our other resources. It also allows us to better use our personal protective equipment and protect the people who are running the testing clinic. It's really hard to interact with someone from 6 feet away through a mask or a face shield. So this way you get to talk to a nurse one-on-one over the phone, and you know the time that you will get for testing is guaranteed for you and that is your time. Lastly, it's just a better service. Remember how the DMV used to get a bad rap for really long lines, waiting, and frustration? We did not want that feeling to happen here, especially when someone is sick and anxious. If you're not well, we totally respect that. We don't want to add to the frustrating day into the mix of you already not feeling well. So I want to talk a little bit more about numbers. I want to pick up where I left off yesterday on some questions that we've gotten regarding the numbers and the forecasts. Like I've said before, some numbers, like the number of positive cases, is really easy for us to track and report on. Others are not as easy as they change, or the tracking and reporting system is just much more time intensive. So today I want to talk about the total number of tests that have been done for Missoula County residents. People want to know the number of tests completed in each county, and I understand why they want to know that number, but it is one of the really hard numbers for us to get with any kind of accuracy. One, the testing is happening all the time at different clinics, hospitals, and providers' offices. These tests are shipped to the state lab or to a couple of different private labs for processing, and we find out about those tests after they have happened, so there's a lag in data. It's not real time. Plus, not all providers who test for COVID-19 report their numbers to us. The providers who do report send us the information, and we sort it, log it, and then someone counts everything. As you can imagine, some days that can be a really tedious process. What we can give you is a reasonable underestimate, but we can't guarantee you an exact number. What we can tell you is that at least 1,110 tests have been done in Missoula County, and that the true number is likely higher than that. We will do our best to report these to you, but we may not be able to do that daily. So I just want you to keep in mind that things change a lot during the day. This is definitely an ever-changing situation, including the time period between when I record this briefing and when we're able to get it out to the public. So that's all I have for the daily briefing for today. As always, you can certainly subscribe to me on YouTube under my name, Cindy Farr. Click the notification bell so that you're notified whenever another video is uploaded. You can follow us on Facebook at the Missoula City County Health Department. Check out our website at missoula.co/cvirus. And as always, if you have any questions about COVID-19 in general, or you want to find out if you're a candidate for testing, please call 406-258-INFO. That's 406-258-4636, and someone will answer the phone from 8 to 5, Monday through Friday, and they can help answer any questions that you might have. So until tomorrow, thank you for everything that you're doing, Missoula, to try and protect our Missoula communities and keeping everyone safe and healthy, and stay well, and I'll talk to you again tomorrow.